Welcome to Holistic Health for Happy Kids, the podcast where we dive into the root causes of children's health challenges and explore natural solutions to help little ones thrive. I'm Lisa, a passionate pediatric naturopath and mum of 3, dedicated to empowering parents with practical tips and expert insights to raise healthy, happy kids. Each episode will unpack common childhood health concerns like allergies, eczema, fussy eating, and gut health, and share evidence-based advice to support your child's wellness naturally. Let's create a generation of thriving children, one holistic step at a time. Thank you for joining me on this journey. Welcome to today's episode of the podcast, Holistic Health for Happy Kids. And today we're joined by Bec Holt from Developmental Dental. And Bec is an oral health therapist and an orofacial functional therapist. So welcome to the podcast, Bec.
Thanks for having me.
So that was quite a mouthful, even describing what you do for your job. So why don't you explain a little bit about yourself, what sort of qualifications you have for that massive job title and what you actually do day to day?
Sure. I am an oral health therapist, which means that I do dental treatment mainly for young children. And then the orofacial myofunctional therapy part of the title is where I'm working with the muscles of the lips, the cheeks, the tongue, and we're working on either restoring or developing correct oral function so that the teeth are growing nicely aligned, the airway is growing in an optimal way, and so that we get these beautiful, healthy faces, but more importantly, we're getting our kids breathing and sleeping properly so that they can grow to their full potential.
It's so funny when I put out, to people who follow me on Instagram, who would you like me to interview in the podcast? There was so many different sort of orofacial, myofunctional facial people that said, oh, talk to them. So I think 5 years ago, if I'd have asked the question, nobody would have suggested this. Like, it seems to be an area that's definitely being recognized as so important for so many aspects of children's health.
Yeah. So it's actually been really great. It's a really great time to be in this orofacial myology world because the awareness is getting out there. There's definitely more people that know about it, more patients that are reaching out for this more sort of holistic root cause approach to, perhaps why their kids' teeth aren't developing the way they should be, why their child isn't sleeping properly. It just affects so many things. Tongue ties is obviously a big buzzword at the moment as well. So it's so great to be in this space and just working at getting to the root cause of so many problems that mouth breathing can impact.
Yeah, and you do home visits, which I find really interesting and obviously fantastic when you've got multiple children and just busy lives. So I've just never heard of that. How did you get started with home visits?
I just really saw a need for it. So the whole idea came to me because when I was pregnant with my second child, I had a independent midwife that would come to my house, and we developed this relationship, over the course of the pregnancy. And then it was really all the sort of the post-op visits, like all the check-ins, all the information and education that she was giving me as a second-time mum. But you still learn with each child. And I just thought, this is so great. I'm in the comfort of my own home. My toddler's, happy playing over there. I'm sitting here with a cup of tea. Everyone's all relaxed. She's giving me this information in a non-clinical, easy to understand way. And it's just hitting really well. And, wouldn't this be great if there was somebody that could do this for families in the dental realm? And it's just not something that I had come across or that I thought was happening, and I saw a real need for it. So yeah, I thought, why not give it a go myself? And it's really taken off. So yeah, it's great.
So you're in Perth. So what area of Perth do you service for home visits?
Pretty much most of Perth. So I've got patients, for the Perth people, they'll know, I've got patients all the way down in Mandurah, all the way up in Yanchep, and I also see one beautiful family all the way out in Clackline, which is about an hour and 10 minutes away from me. So I see most of Perth.
Wow. I suppose it's not massive, but still, it's, yeah. So I'm super interested in this topic because I've had quite the journey with one of my children's teeth. And I think I have terrible teeth myself. My husband has shocking teeth, so it's kind of not surprising that she didn't have great teeth. But her diet was always great. We were at the dentist from she had teeth. We were brushing twice a day. We were doing everything. And she still ended up with silver caps. And I didn't know that I was not brought up to floss. Nobody ever told me to floss when I was a child. So I actually just didn't know that children were meant to floss. But apparently they are. And once we started, it solved a lot of problems. So where do you stand on flossing?
Yes, absolutely. I agree. So as soon as the baby teeth are touching, we need to start flossing. And I'm sure everybody's thinking, I can barely brush my kids' teeth. How in the world am I going to try and floss for them? But when we're brushing teeth, we can get the chewing surface of the teeth, we can get the front of the teeth, and we can get the back of the teeth. No matter how good you are at brushing, there is no possible way that the head of a toothbrush is going to fit between two teeth unless you've got these beautiful big gaps. So if we're not flossing, then that's two sides of every tooth in the mouth that's just being left exposed to the plaque and the acids and the bacteria that can develop into a hole. And the problem with that is that if we do have teeth that are really close together, it's often an end stage cavity that we can see. So these things will start as really, really small holes, but then by the time we see them, they've been there for ages. And that's when, unfortunately, we need things like general anesthetics or local anesthetics or stainless steel crowns, like the caps you're sort of referring to. We often can't get away with just a little white filling once it gets to that point. So if we can floss, then that's one thing that we can do to sort of try and prevent these types of cavities.
And so, like as you alluded to, it's extremely difficult
It
for
is.
for all children because they've got the teeny tiny mouths and we've got our big fat hands. So how do you do it?
So there are these really great little flossettes that you can get. So I don't know if you've seen them, but it's like floss on a stick almost.
Yeah.
And that just takes away, well, you can get some really fun, colorful animal ocean themed ones. But also it does take away that problem of, as you sort of alluded to, fitting two adult sized hands and a piece of string into a tiny 2-year-old's mouth. Whereas you can keep essentially your hand on the outside of the child's mouth and you've just got the flossette in there, and that's all you need to do. So it just takes away that problem of having the room to get in there, but there's still the compliance issue, which is an issue with brushing as well. So my biggest tip that I give families is start really early. Have your child watch you flossing from a very early age. And with the flossettes, you can do lots of sort of fun play-based introduction with them as well. So I like to tell families, roll up some Play-Doh into a sausage, use the flossette to sort of cut it, make some, flossette shaped stamps in the Play-Doh, use it for sort of threading activities. You can make a necklace out of it if you want to. There's just so much, so many ways that we can introduce young toddlers, especially, to these concepts and products in a really fun, non-threatening way than being, okay, this is the first time you've seen this thing that looks like it can cut you, come here and I'm going to put it in your mouth. That's not going to work. So we do need to be mindful of how these concepts are introduced.
So yeah, same as with food, really. You're just introducing it in a play setting and then you kind of work your way up to it.
Absolutely.
And then, so a lot of people, and I even heard this in the last week talking to clients, but a lot of people just think that, baby teeth, who cares? They're going to fall out anyway. But obviously it's not that quite simple. So why do we need to be so careful with our baby teeth?
Yes, this is what I spend a lot of my day talking about, because a lot of people do have that misconception that their baby teeth, they're going to fall out anyways. It doesn't really matter. So a lot of parents are actually surprised to learn that the second baby molars, which are the ones that come through at about, between 2 and 3, so about 2.5, we actually can keep those baby teeth until about 12 or 13 years old. So that's about 10 or 11 years that those teeth need to be kept safe in the mouth. So if your child gets a cavity on that tooth at 4, for example, that's a really long time that we need to keep that tooth safe. The other, or the one of the main reasons why baby teeth are so important is to hold that space open for the adult teeth that are developing underneath. Not to mention normal function. So, talking, chewing, smiling, social interactions. You hear some awful bullying stories about, kids and their teeth, and like pain. Obviously we want to keep these kids out of pain. There is so many school and work days lost due to dental pain, and a lot of this is preventable. Not all of it, but a lot of it is really preventable. So it's so important that, and the other thing is, it's so important that we develop these habits with our children really early. You don't want to wait till your kid's sort of 6, 7, 8 and then being like, hey, it's actually really important to brush our teeth. Like, this should have started as soon as they had a tooth, So yeah.
Like my son is 10, and one of his little friends at school has just missed weeks and weeks of school because he had gingivitis.
Oh, wow. Yeah. That can be really painful for kids.
And it's a gum infection, isn't it?
Yeah, so essentially it's the inflammation of the gums. So there's lots of things that can cause it. The biggest things are, put it in a nice way, suboptimal oral hygiene. So, poor sort of brushing and flossing techniques. Mouth breathing can also cause gingivitis. As you would know, specific bacteria in the oral microbiome can contribute to gingivitis. But the biggest thing is that brushing and flossing and really looking after the health of the gums. And the problem with gingivitis, especially in young children, is that once the gums become inflamed and swollen, to brush them and clean them is actually really painful and it makes them bleed. But unfortunately, we need to get past that sort of point. I tell the kids, it's not a bad thing if they bleed, because that's all the yucky germs that are coming out, and those yucky germs need to come out for your gums and your teeth to feel better. So, we can sort of give some pain relief options, like, if patients are using homeopathics, for example, like, it's really good to use those alongside it. Saltwater mouth rinse will, always help to sort of heal up the gums a bit faster. But the main thing, I cannot stress it enough, is just really, massaging that gum line with that toothbrush. Like, it's just so important. And a lot of parents, a lot of us have experience with things like recession and wearing away the gums, or we've been told we're brushing too hard, and that just doesn't happen in kids. The gums are much more robust, much thicker, and yeah, we really need to get in there and do a good brush to prevent these things like gingivitis.
My middle daughter, she has congenital heart disease, so she's got a lot of fake plumbing in her, like bits that do not belong to her. So she's at very high risk for endocarditis. Anytime she's even getting her teeth clean below the gum line, she needs to take antibiotics prophylactically. So you can just imagine if a child with that condition then got gingivitis, it would be a very, very dangerous situation, wouldn't it?
Absolutely. Yep.
So
100%.
Definitely special categories of kids where you have to take it even more.
For sure.
Of course, she was the one who got the silver caps,
Yeah. Diabetes is also really closely linked to gum disease as well. So, it's really important in especially young children, that the gum disease is managed, or that the gum health is managed well, and that the diabetes is managed well, because those things can sort of exacerbate each other. So that's another link that we sort of look at in young kids.
Yeah. And so silver caps, again, it's a bit of a newer phenomenon. I guess in my day, they just put in amalgam fillings. But what do you think about the silver caps? And is there any toxicity risk with those?
So with silver caps, I was actually talking to a patient about this yesterday. So the first thing that I just want to make super, super clear is that amalgam fillings, which is where we've got the concerns around the mercury toxicity, and the stainless steel crowns, are two completely separate materials. Amalgam is very, very rarely used anymore. I don't know of any dental clinics that use it. None that I work in absolutely do not use it, and I would never use it. The stainless steel caps, or the crowns, so they are made from stainless steel, obviously. The only sort of real concern from my point of view is if a child has a nickel allergy, or that they're reacting to nickel, or there's concerns around sort of like heavy metal issues, because they can contain nickel. And obviously, if it's something that's stuck in the mouth for a long period of time, we want to make sure that there's sort of no sensitivity there that's going to exacerbate any existing problems. Usually, if that happens, though, we do get some sort of signs and clues that something might be going on. But in terms of how good are they as a restorative option, it's the gold standard for restoring a tooth if a filling is no longer a viable option. So that means that if the decay has gotten to a point where if we were to put in a white filling, it's just likely that the tooth would break, or that the tooth would develop a crack. So it's almost like, I explain it to patients sometimes as like an armor guard for your tooth, and it just goes over the entire tooth to protect it. And, I would never say never and never say always, but you can pretty much sort of not forget about the tooth, but that tooth is really well protected for its life. So the crown will just, or the silver cap will just fall out when the tooth falls out. And I like to tell the kids that the tooth fairy brings extra for those teeth because they've had to work harder to keep them clean and all that. But yeah, otherwise, it's a really amazing way that we can restore function in an otherwise really compromised dentition. Like they are just, they're quite easy to place in a kid that can cope. And yeah, you just clean them any other way that you would a normal tooth, brush them normally, floss them normally, eat with them the same way. Obviously it's good to avoid hard sticky lollies, which kids shouldn't be having anyway. But I use them and I promote them and I recommend them. I think they're great.
So in an ideal world, would you catch the hole before it came big enough to warrant the cap?
Absolutely. There are some circumstances where that may not be possible. So things like enamel hypomineralization, for example. So that's where, for the listeners that aren't aware of it, because I know you are, that's where the teeth essentially, they're not developed with strong enamel. So the teeth have developed incorrectly. There either hasn't been enough nutrients and minerals during pregnancy, or there's been antibiotics very early in life, or there's been a traumatic pregnancy, or mum's been unwell during the pregnancy. There's some sort of interruption to that development of the enamel, and the enamel hasn't developed to its full potential. So these teeth can come through pretty much already crumbling, and it's through no fault of brushing, sugars, anything like that. There's nothing that we can do. And with these teeth, they are very often very sensitive. So some of these kids can't even go outside and open their mouth to take a breath because they're so sensitive to cold. They can't, they don't like having their teeth brushed because using the cold water, and then it's just a recipe for decay. So these teeth, we would very, very strongly recommend to have these caps placed over the teeth. Yeah, for sure.
Yeah, so my daughter had hypomineralization on her baby teeth, but then her adult teeth are fine. So, and she would have had a lot of intravenous antibiotics for the first 3 weeks of her life. So that would have then caused the hypomineralization.
Definitely contributed. Yeah, I would never say cause because you don't know what else is going on. But yeah, for sure. And my son's the same. He's got the same condition. And, it's really heartbreaking because you think I've done all the right things. And so yeah, sometimes, there is a genetic component to it as well. I've got one tooth like that. My son's got two. My daughter missed out, thank goodness. But yeah, just because you see it in the baby teeth, as you've alluded to, doesn't mean you see it in the permanent teeth. So it's just one of those things that we've just got to keep a really close eye on, and just sort of manage it accordingly.
I was insanely devastated whenever she got the caps. Like, I really did not have a normal response to that. I really lost my mind over it because I was just so disappointed that I had done everything right and then that happened. And I think the dentist thought I was crazy, unfortunately. Oh wow.
No, I can understand. I saw that tooth in my son's mouth come through, and I think I cried for like 3 days straight because I was like, no.
I know. So now one of probably the most controversial things that we will talk about is fluoride. So there's fluoride in a lot of water systems, and then there's fluoride in toothpaste. What's your view on fluoride both in the water and then in toothpaste?
I don't use fluoride for my family and for my children. It's not something that I recommend. I think any sort of like mass medication, I suppose, like with it being in the water is, a little bit dangerous. I think, your body, your choice, we should sort of be choosing what we're putting into our body. So I don't love it in the water. The other thing is that, fluoride can be really helpful in very specific circumstances, which is, in a really localized area when we've got really good evacuation around the area, everything else is, covered with a covering, like a rubber dam type covering. But if we're having it in the water, we're ingesting it, it's not only being swallowed, it's also being absorbed by all the mucous membranes. And, at the end of the day, we don't, like, even other dental professionals will say it's this topical effect that we're looking for. We're not looking for the systemic benefits, because there isn't any. So I'd much rather prefer my patients be using a toothpaste with hydroxyapatite in it. So that's essentially, I usually say, it's the safe and natural version of fluoride. It's really great at remineralizing teeth. It's not damaging to the oral microbiome. And the toothpaste brands that I know of that contain it, they taste really yummy. It's really easy for kids to tolerate. And usually, if it's a toothpaste that contains hydroxyapatite, it's a more holistic, natural toothpaste anyway, that's not containing all the other nasties as well, like the SLSs and all those sorts of things. So, yeah.
What my thoughts about fluoride is, you've got a 70-kilo man who's drinking 2 liters of water every day. And then you've got a 8-kilo baby on formula who's maybe having a liter of water every day.
Yep.
So the tiny baby is having half the amount of fluoride as this 70-kilo man. Like it doesn't make sense, does it?
No, and things like fluorosis, that's a real risk as well. So more so for these babies that are on formula, and the formula is being mixed with tap water. So I guess some signs to look out for that fluorosis may be an issue are little chalky marks that you can sometimes see on the teeth when they come through, and sometimes they're white, sometimes they're brown, and it's it usually is related to an over ingestion of fluoride when those sort of teeth were developing. So that is a real concern as well. And it's just not an issue with hydroxyapatite, and it's such a great active ingredient, and it just does so much good for teeth. And I just think if we have such a great alternative that doesn't have the same risks that fluoride does, then it's a no-brainer. Like, why would you not use it?
So what toothpaste brands do contain the hydroxyapatite?
Do you want like a specific brand?
Yeah.
So the one that I recommend for my patients, it is a really expensive one, but the brand is FIG. So it's FYGG, and it stands for Feed Your Good Guys. So it's an American product that was developed by 2 holistic dentists. One of them is a pediatric holistic dentist over in the States, and it comes in chocolate, vanilla, and a sweet mint flavor. So there is no issue getting kids to have it. My 6-year-old loves the vanilla, and my 9-year-old loves the mint. I use the mint as well. It comes in quite a big tube. There's no nasties in it, so you only need a really little bit. It's not super like runny like some of those other toothpastes. And the other benefit to the FIG toothpaste is that it's got the oral pre and probiotics in it as well, which is obviously super important for keeping a really healthy oral microbiome. So yeah, that's the one that I recommend the most. Mugu is another one that is not too bad, although I think they recently changed their formula, so I've not recommended that one as much. But yeah, there's lots of different brands. I know a lot of young toddlers will use things like Jack and Jill, or people that want to avoid fluoride will use things like Grants and all those sorts of things, which is a fine option as well. I just think that in the kids that are more high risk, so in the mouth breathers, in the kids that are tongue-tied, in the kids with the hypomineralized enamel, they need something remineralizing in there, which is when I recommend the hydroxyapatite toothpaste. So it's a good one to use for everyone.
And that FIG it's American, but it's obviously available in Australia.
Yeah, I'm not sure over where you are, but in Perth, there's only one place that I've found it so far, which is an online health food shop. So it's called the Short Street Kitchen. So it's an online health food shop that stocks it, and yeah, they're actually a family that I treat. So it's always nice to support local as well. And yeah, they're the only ones that I've found that are actually stocking it in Perth. So yeah,
I will be buying that for my family.
Yeah.
And so, what about tooth mousse? Is that the same thing?
No. So we've got toothpaste, and then the tooth mousse it's more of a therapeutic agent that we don't sort of use across the board. So the problem, one of the only problems, I suppose, with tooth mousse is that it does contain dairy. So for kids with a dairy allergy, that's out. So for example, my son, he's CMPA, and he can't have that. It does really help with a lot of hypomineralized teeth, though, because what it does is it puts back things like the calcium and the phosphate and some of the nutrients that these hypomineralized enamel are missing out on, or the things that they're sort of lower in. So it does really help to sort of remineralize these teeth and strengthen them and make them more resistant to decay. So when I recommend this specific product for families, I say to put it on after brushing, so brush your teeth as you normally would, have your drink of water, do your bedtime routine, and then just before you go to bed, squeeze a bit out, rub it all over the teeth, and then the child can either spit the excess out or they can swallow it. It is a food grade product, and then just go to bed. So that needs to be the last thing that goes on the teeth before they go to sleep. And I do recommend it a lot for a lot of families. Again, tastes really yummy. There's no fluoride in it. And yeah, it's a very easy thing to apply and sort of add into your routine. So yeah.
So what about food and diet? Do you talk to parents about food, diet, or what sort of advice would you give to people generally?
Yep, absolutely. So, I mean, I think everybody knows like the no sugar thing, or, try to sort of limit your sugars where you can. The things that I sort of tend to talk about are the less obvious things. So, like really including a lot of like good quality red meat in the diet for young kids. So we're really looking for things that are containing vitamin D3, K2, vitamin A. So a lot of, I will recommend that some families supplement with things like cod liver oil, just for that vitamin A to really kind of like beef up the teeth almost and make them more resistant to decay, especially the high risk families or the high risk children. The other thing we talk about is fermentable carbohydrates, all the crackers, all the breads, all the pastas, all of these things that at the end of the day, they are healthier than lollies, and there is some benefits to these foods, but at the end of the day, they are going to break down to a sugar, and the teeth are not going to view them any differently than a sugar from a lolly. But also these foods are sticky. Like bread just sticks, pasta sticks, rice sticks to your teeth. And it's not about completely eliminating these foods from your child's diet. It's just about being mindful of how often we give them, what else are we giving at this same meal, and obviously making sure that we're really giving these teeth a good brush and getting rid of these sticky bits. Because the other thing that we sort of look at is the frequency of food. So toddlers are grazers, or kids in general, I should say, are grazers. They like to just eat a little bit here, a little bit here, a little bit here. Every time we introduce something into the mouth, it alters the pH of the mouth. It takes about 20 minutes for the mouth to catch up and get back to a neutral level. So if we're having a sip of juice, for example, 15 minutes later, having a grape, 15 minutes later, having a slice of apple, 15 minutes later, having, I don't know, a lolly, like the mouth just doesn't have a chance to catch up. So then we're reducing the pH in the mouth. It's just this beautiful, breeding ground for bacteria. And I tell kids, all the bugs are having a sugar party in your mouth, and they're just, chipping away at all of your teeth and making all these holes. So again, it's not about eliminating these foods. It's about, if you want to give your kid a little sweet treat, that's great. Give it with a meal and make sure that they're following it up with water. For the children that don't react to dairy, it's a really great idea to just keep some, cubes of cheese around. So every time they have something sweet, follow it with a little cube of cheese, just to, again, help bring, that pH back to neutral. There's lots of different things that we can do. And it's not all about sugar. I find a lot of kids aren't having enough red meat. For some kids, it's a functional issue with the chewing. Some it's a taste issue. So we can look at things like beef jerky, or sort of slow cooked meats, or the beef liver powders. Like all those sorts of things are really good ways to get these nutrients into your kids if they're not going to munch on a steak or something.
Yeah. And I mean, whilst you say everybody knows about sugar and teeth, I think people don't seem to remember that, because when I look at people's food diaries, like the number of sticky sweet foods that are in their diet daily, like muesli bars, they're sort of
fruit straps.
Yeah, like constant kind of sugar hits. And the thing that drives me nuts when I'm looking in like a Facebook group or whatever, and somebody says, I've got a fussy child, there'll always be somebody who'll pipe up and say, oh, all you do is you just put out like a grazing platter for them at the start of the day, and you just let them graze from it all day long. And and I'm like, no, it's literally the worst piece of advice that you could give anyone, for their teeth, for their gut, and for their actual appetite for real food at mealtime. So do not go with just the all day long grazing platter. Really bad.
Yeah, and I will say, just because it's a really, really common snack for young kids, because it's easy, it's convenient, and they love it, sultanas and raisins are horrendous because they're sticky. So they will stick in those grooves of those back molars until the cows come home. And if your kid is a kid that's not going to let you get a really effective brush, like let's face it, is most children, that like you're not going to get that sticky stuff out. So I would include sultanas like in the same badness category, I suppose, as like a lolly. Things like dark chocolate is not as bad. I mean, I'm not saying fill your kid up on dark chocolate, but at least that's something that's going to dissolve, and at least it's got the benefits of magnesium, so it's like a little bit healthy. But I'm just sort of trying to get the point across that we don't have to remove all these things. Like, they're kids, you want to give them treats, you want to make them enjoy eating with us. But we've just got to be a bit more mindful about how we do it.
So no sultanas in the lunchbox.
But no sultanas, please. Yes.
So a lot of the kids that I see, and I'm sure a lot of the kids that you see, are highly sensitive children. So how do you help, highly sensitive children actually cooperate with your dental treatment?
Look, it's so individualized, I will say that, and what works for one child won't work for the next. But some things that work universally across the board, having a big sibling, a friend, a cousin, whatever, modeling the behavior first is always a winner. I was with a family on Friday. There is I'm pretty sure there's a 4-year-old, a 2-year-old, or that actually, no, it might be 5, 3. And then there was a 1-year-old, and she watched her 2 older siblings go first. And that kid lay there, still as anything, kept her sunglasses on, let me do a full examination. She was a legend. I mean, it doesn't always happen like that, but, that's the power of modeling. And, I think the way that parents prepare their child for my session is so important. I can empathize with and I understand, parents that have had bad experiences themselves as a child. And I cannot express how important it is that you do not, unintentionally, I'm sure, project that onto your child. So saying things like, don't worry, it won't hurt. They won't give you a needle. I'm here. Do you want me to hold your hand? Those sorts of things are not helpful comments. Things like, as soon as I get there being like, oh, I'm so glad you've got this service. I hated the dentist when I was little. I had all of these, bad experiences. And I'm thinking, talking, and it can go the other way too. So some parents will sort of over prepare their child, with the best intentions. But the child's thinking, wow, I don't get this much notice when we go to Woolies. I don't get this much chat when we go to a birthday party. What's going to happen? Why is this such a massive deal? So, when I welcome families into my clinic, I do, send out some information on the best ways to prepare. But I think just being quite casual, calm about it, referring to me as a friend, or if you know somebody that's seen me, just casually drop that in the conversation. Hey, little Max said that he saw, Bec the other day, and, she counted his teeth and they played some games and he got a cool prize bag at the end. Shall we do that? Because I don't know how many teeth you have. And, I think your kindy teacher might really want to know that. And just things like that, making it super casual, but also letting them know what's happening. The worst is when I come into a house and the child has no idea who I am and what I'm doing there, and then they're just thinking, what is going on? Which doesn't happen that much because I do try to prepare parents, but some people I think just think, oh, my kid will be fine, and then they're like, oh, who are you?
It's funny, my least cooperative child is my 3rd child, but for the dentist, oh my God, he has been a legend from the get-go. He just gets up and he doesn't cooperate with a lot of stuff at home, but it's obviously just because he's seen his older siblings just do it. And he just what we do. We just sit here, we open our mouth, put on our sunglasses. So it's obviously that seems to work then.
Yeah, and I think, being in the home really, really does help. It's their safe space. They've got all their toys. I bring some toys. The prize bag obviously helps as well. And just, being able to sit on mum's lap and have that examination done is very different than sitting in a chair that goes up and down and, smells like clean and dentist and everybody's in white and, there's a big bright light in your face. It's a very different environment, which obviously helps. Yeah.
So another thing that you're very interested in is tongue ties. And I'm always just not sure about tongue ties. But then I was listening to a podcast recently about breastfeeding tongue ties. And I was going, oh gosh, clearly my eldest child had a tongue tie because she was just everything they said. Oh yeah, that's so. For breastfeeding mothers, we're going a little bit off topic now, but breastfeeding mothers, what would make you suspect that their child had a tongue tie?
I just want to start this bit of the conversation with, I am not a lactation consultant, and I do refer a lot of the breastfeeding babies with these feeding issues off to lactation consultants. I work with a couple of really beautiful lactation consultants that I completely trust and are very versed in the tongue tie world. But yeah, so signs to look out for are varied. So popping on and off the breast, clicking, having milk spill outside of the mouth while trying to feed, really just unsettled feeders, what am I saying? Like weight gain issues, so issues with not gaining weight, really mucusy, yucky, not normal poos, really just colicky babies that are always upset, never happy, quite gassy babies when their belly's distended. What else? And obviously like the, from mum's end, like recurrent mastitis or, recurrent blocked ducts means that the baby's not sort of draining the breast properly. Nipple damage, so many different things that we can sort of look out for, which is again, sometimes in these mum groups is often, or these online groups is put down, oh, but babies cry. Oh, but breastfeeding is hard. Breastfeeding is painful. That's normal. That's not normal. Yeah. It's not normal at all. Please, if you are having problems with breastfeeding, please seek out the knowledge of an IBCLC, which is an internationally board certified lactation consultant. And please make sure that it's somebody that's done extra training in tongue ties, because not all training is the same.
So what do you see then in the older children? Like once they're past the breastfeeding age, tongue tie hasn't been picked up, then they're your client. What do you see?
So things that I could possibly see, because I will say it's not the same for every child. And this is, I think, part of the reason why tongue ties get a bad rap, because some people will say, oh, well, my child's got a tongue tie and we don't have any of those issues. Or, my child doesn't have a tongue tie and we have all of those issues. So it does affect every child on a very individual level. But things that I tend to see, or one of the main things that I see, is a high and narrow palate and not enough room for the teeth. So in children, when they have their baby teeth, it's normal, and we want to see lots of gaps between these baby teeth. The reason for that is that when the adult teeth come through, they need room because they are much bigger than the baby teeth. So sometimes I'll get parents and they'll say, their bite's great, they've got a beautiful smile. And then I look at this poor child and all of the teeth are lined up beautifully like a little white picket fence. And yeah, it does. It looks beautiful now, but where are these adult teeth going to go? So not only that, but when we have a high and narrow palate, it's very difficult, or when we have a tongue tie, it's very difficult for the tongue to be in what we call the correct oral resting posture, which is so important for so many things. But the correct oral resting posture is when the tongue is lightly suctioned up to the palate. So if you've got a really high palate and your tongue can't get up there, or you've got a tongue that's tethered to the floor of the mouth and it can't move, you are never going to get that tongue up there. And the tongue being up there is part of what helps develop and grow that palate wider. So it's, these are the things that lead to mouth breathing and then to braces and extractions and all of these things. So it's so important that we do these sort of early screenings. And having two used to be tongue-tied children myself, like this is the passion project for me. Like, it's getting this awareness and this information out there, because tongue ties can affect so many things. And with the right support and education for parents, like there's so many things that we can do, and it's not, oh, let's just, release the tongue tie and all will be well. Like, there is so many things around it that are so important for getting this growth and development right. And this is my whole thing about, like, for example, giving parents some suggestions on, making sure that we're offering enough chewy foods in the diet, avoiding the pouches and the purees, looking at what type of water bottle your kid's drinking out of, what sort of habits they've got, are they a thumb sucker? Are they a dummy sucker? How long were they on the bottle for? Did they then transition to a sippy cup? What sort of foods do they avoid? What sort of foods do they crave? Like, those sorts of things are all so important. How do they breathe? How do they sleep? All of these things. Sorry, I'll go on a rant if you don't stop me.
It just shows, like, I guess, why we work with you so closely, because the things that you say, and you're coming from a teeth, mouth, breathing perspective, are exactly the same as the things that we say, but we're coming at it from a completely different perspective. I was back in Ireland recently, and I was staying with my friend, and I think she thought I was crazy as well. I was looking at her teeth, her children's teeth, and I was going, oh my God, you've got so many gaps between your teeth. This is amazing. And she was kind of going like, what on earth are you talking about? But I think you just don't see that very often when you actually look at your child and you see that they're like little gaps like in all their teeth.
I get so excited, and I can think of a child that I saw a couple of weeks ago now, and like the mum wasn't as excited as I was, and I was like just wanting her to be excited, and I'm like, you don't understand, like I don't see this is like a treat for me to see these beautiful big gaps everywhere. And she was just like, oh, okay. Like I'm like, no, this is amazing, get excited.
Yeah, my friend wasn't excited either, I have to say. But when I thought about it, my friend grew up on a farm in Ireland, and they drank raw milk straight from their cows every day. And I was just like, oh my God, like this is Whitney Price in practice. She grew up on raw milk. Her husband is a big, strapping, like solid build guy. So like he has sort of good nutrition as well. And then they've created these little kids with gaps between their teeth.
I wonder.
Yay! And so mouth breathing, we've talked about that in relation to tongue tie. So something that I've seen, oh my God, I've seen people recommending that their children's mouths get taped when they're mouth breathing. I'm going, but then they can't breathe. So tell me, well, in 50 words or less, tell me all about mouth breathing.
Okay, so I definitely do not recommend lip taping for children, especially for children that have not had an ENT clearance, or at least a proper airway assessment by an ENT, because that is just not okay. Your child will not be able to breathe. So mouth breathing, we look at, well, I look at, why are they mouth breathing? So the nose is designed for breathing, not the mouth. That is one of the first things that I will teach these kids when I see them. But my kids will point out mouth breathers to me on the street, on TV, in a magazine, and I'm like, okay, yep, we know that. But obviously tongue tie is one thing that we look at. We look at allergies, which is a huge thing. And a lot of the reason why I referred it off to you guys, we look at big tonsils, big adenoids, nasal congestion, a lot of mucus production in the body. Low tone is another one. So these kids that aren't getting these chewing opportunities, they're not developing these muscles properly. And then, once we work out the root cause of, okay, well, we know why this is happening, let's try and treat that. So whether that includes an ENT referral, a naturopath referral, an allergist referral, it could involve many different things. Then just because the airway has been cleared, your child doesn't just magically wake up the next day and start nasal breathing, because then it's this habit that they've developed. And this is where the myofunctional therapy comes in. It's teaching these kids that this is what the muscles need to do, and they need to do them every day. And here are some exercises to learn how to do these things. Here are some strategies that we can put in place at home to make sure that, you maybe don't get as congested, or that you are getting offered, more chewy foods, or that, you are using this drink bottle, or whatever it might be, because we need to work these muscles to help them build up to a point where the child is breathing through their nose with their lips sealed and their tongue lightly suctioned up to the palate. Because that is, if you have those three things and a correct swallow, which comes much later, then you've got the perfect foundations to develop these beautiful arches and nice wide airways, because they will provide the fencing, the scaffolding, whatever you want to call it, the foundations for the teeth to grow around. So that's the aim of the game. That's what we're trying to do.
Yeah, I think I'll probably get you back down the track to just talk about that in a lot more detail, because I know people are so interested in that topic. Thank you so much for joining me for today. Did you have any final comments that you want parents to walk away with?
Yeah, just a lot of parents are really shocked to learn that the ADA, the Australian Dental Association, recommends that children have their first dental check when their first tooth comes through, or by their first birthday, whichever comes first. And that doesn't mean that we're going to hold them down and make it a big, really traumatic experience. That may be just a chat, a play with the toys, and just giving the parents some education around bottle feeding and dummies, for example, or, some, light breastfeeding advice, or whatever that may be. But we just want to get this exposure happening. We want to get the awareness happening, and, just getting the kids to have a positive experience first up, so that then they can have a really, positive, happy, lifelong dental journey. Because, it's something we all need to do it every 6 months for the rest of our lives, as long as we want to keep teeth. So yeah, start them nice and early. Yeah,
totally agree. So Bec is on Instagram as Developmental Dental. She works all over Perth, and she does home visits. As you can tell, she's an expert in anything mouth related. So give Bec a follow on social media so you can keep up with her. So thank you so much, Bec. That was so interesting. I really just treated it as a little consult for my own personal problems, but thank you for that.
Thanks for having me. The time flew.
Yeah, I'm sure we will have you back again soon. So
sounds great. Thanks.
Thanks for tuning in to Holistic Health for Happy Kids. I hope you found today's episode helpful and inspiring on your journey to raise thriving, healthy little ones. Remember, small, consistent changes can lead to big transformations. If you enjoyed this episode, please subscribe, leave a review, and share it with other parents who might benefit. You can also follow me on Instagram and Facebook at The Pediatric Naturopath for more tips, tools, and inspiration. If you've got a question or a topic you'd love to hear about, please send me a message. I'd love to hear from you. Until next time, take care and keep supporting your kids in the most natural, nurturing ways possible.